talk by Dr. Ria on injury prevention. This is something that I think all our dancers, young and old, young and not so young, must know. And this is again in collaboration with the Performing Arts Medicine. Dr. Jenny Yang is here. I always want her to give a few words. We are recording so that we can show this again on the website. We're here.
Hi. Hi, this is Jennifer Yang.
This is Dr. Jenny Yang.
I'm from the Performing Arts Medicine Advocates National Association of the Philippines, Pamana PH, and we are excited to collaborate with Artists at Point for today's talk on injury prevention. So I am not a dancer. I will be handling someone who actually knows what he's talking about with dance and dance injury prevention. So thank you very much for tuning in and welcome.
So we give the floor to Dr. Ria, who will give the talk on injury prevention.
So thank you for Dr. Jesse and Dr. Yang for the introduction. So injury prevention is very important, and I think it may be timely during this time, especially coming into the summer months, where we're going to already have our workshops, especially for the kids and those who are already going into the dancing. So injury prevention, just a quick survey. Who here in the room has already been injured in the past?
I hope none.
I hope none. Wow. So it is great to see that no one has been injured here yet. I think part of the reason of that is, well, our audience here now are quite young. So injuries in dance usually come in the pre-professional and young adolescent level. The usual injuries that we have are actually here in the hips, in the knees, and the ankles. These are the most prevalent for dancers, especially for ballet dancers, because these are the muscles that we keep moving, which we have already tackled on our last lecture. So types of injuries that usually happen are muscle strains, ligament sprains, and bone fracture, which is not as common but would require medical attention. We have the acute versus the chronic. So when we say acute, these are the injuries that happen immediately, that you feel agad. Kunyari, nagka-class ka, nahulog ka, may tapos you landed wrong when you jumped. And then from there, maybe you already had a sprain. Worst comes to worst, maybe you had a fracture. So that's what we call acute. On the other hand, there's another type of injury wherein it is chronic, meaning it develops over a long period of time, it's gradual, it comes from what we call overuse or paulit-ulit na paggamit ng isang type or isang group lang ng muscles. So for example, you did jumps today, and then you did jumps again tomorrow, and then the day after that. So the muscle groups that you use for jumping will become overused. Now, why do we get injuries? We have risk factors wherein there's what we call intrinsic versus extrinsic. Intrinsic, these are the ones that are more inherent to your body. So it may be from your nutrition, because you are either very flexible or not flexible. Your muscles may be weak, or maybe you have poor technique. Versus what we have extrinsic, so these are the factors outside your body. So this can be an environment that is unsafe, for example, your flooring, your lighting. It can be your shoes are in the wrong size. It's too hard, it's too slippery. Or your costumes make it hard for you to breathe, or they're too heavy for you to move. It can also be a factor of what types of dance or choreography you have. So for example, classical ballet, they have point shoes. So they are very prone to, let's say, ankle injuries when they land wrong from their points. However, when we say, for example, hip hop dancers or break dancers, they have a lot of stunts. So they can be more prone to falls, to head, to neck injuries. And then it can also be from your training syllabus or your structure of how rigorous it is. And again, overtraining when you do not have time to rest. So the goal of our injury prevention is we want to modify what you can control. Okay, so whether that's the intrinsic or the extrinsic factors. So can I ask the students or the teachers here today, in a normal ballet class, what comes first? The center, the bar, or the across the floor?
Bar.
The bar, yes. So usually it's the bar. It's usually the bar, followed by the center, followed by across the floor. So this structure actually already follows something in the pillar of our injury prevention, which is proper warm up and cool down. Because if you think about it, when you're in the bar, you're using less energy versus when you're across the floor, that's very dynamic. You go from one corner to the other. So here there is a gradual progression of how hard your movements are. So warm up, what we want to do here is we want to slowly elevate your heart rate to get it prepared for exercise. You want to activate your muscles and also to mentally prepare you for the dynamic movements afterwards. And then, of course, at the end of the class, we want to cool down because we also want to slowly bring you back to your resting state. And also, if you, for example, in this area, your muscles are already activated there, you were using them. At this time, they're actually already more susceptible to stretching. So here is where you can also improve your flexibility. Okay, so review. We had this picture in the last lecture. Which is correct, A or B? So if you know B, oh, so actually the correct one is B. Yes, because if you see in A, the back is too rounded, it's too arched, meaning the core is not as engaged. Okay, so when the core is not as engaged, your balance is off, it's harder to move. Next, which one of these is correct when you go up on points? B. B. Yes. So in B, what we want is that you go over the points such that your weight is here in the box of your shoes. Versus when you're not going over it or you're too over it, wherein your weight is not in the middle. So this again can be prone for injury. So here is our second tip, which is to have your proper technique. And to have your proper technique, you have to know what type of muscles you have to use, which we tackled last time. So here are some common mistakes when it comes to technique. So one is the arching of the back. Next is when you do, so the arching of the back, this will usually lead to back pain. Okay, and again, pause because your balance is off. Next, we have the rolling in, wherein your turnout is being forced because your turnout, the bag is supposed to come from your hips. So if the hips is not as flexible or not as strong, you force the turnout coming from your feet or your knees. So this will strain them and be prone to injury. And then next is the not going over your point shoes. So here, if you see, look at the line, it's diagonal. So when you go up on points, there's a tendency for you to fall. So here we want to focus on, again, turning out from the hips. Your knee has to be aligned straight. So when, for example, when you do your PA, your knee has to go over your toes and not forward. And then again, the neutral spine. And then also, what we want is that you prioritize control over extreme range. So, diba, you have your grand battements. So, when you do your battements, yes, you kick your legs up, but you don't do it while putting your hips up as well. What you want is to make your body neutral and to have the proper technique. So, good form protects your body. Next, I have a question for you. Dancers should only focus on dance and not be involved in other physical activities such as swimming or Pilates. True or false? False. Okay. So there are some who believe that if you're a ballet dancer, you're supposed to just do ballet all the time. But actually, just focusing on one specific discipline can actually make you prone to injury because it is prone to overuse. So what we want is to provide proper strength, proper conditioning, but also what we call cross training. So the most common injuries for dance is the lower body. So the hips, the knees, the back, even the feet. So it only makes sense that this is what you also want to strengthen. So you want to strengthen your core. So examples of exercises for this is the plank, your legs. So and the turn out. So for example, clamshell exercises. And then your feet, you want to work the very, very small muscles of your feet to make them articulate. So what you can do some paraband exercises where you slowly go on point and then demi point and then flex. So that you go through the whole range of movement of what you would do if you were actually on point shoes. And then there's what we call cross training. So cross training is when you engage in activities that are not your primary activities. For example, you're a ballerina and then you engage in yoga or in Pilates or swimming. So we actually promote this because it provides an avenue for you to work the other parts of your body. Hence, you develop overall strength, overall fitness, and it can actually complement instead of contradict your technique. And also, because we want, now while you're using this part of your body, you're resting the ones that you are working very hard on while you're in ballet class. So again, examples of these are Pilates, yoga, swimming, or even actually venturing into other dance styles. Another question. When does a dancer start point work?
Ano yan? Ongoing question.
Yes, it is an ongoing question.
So,
So actually, this one is actually still under study. There are some projects that involve pre-assessment before going on point shoes. But the main concept is we want safe progression, whether that is in difficulty of the steps or difficulty in the point going from ballet flats to point work, or in terms of progression of load, how much you dance, how often you dance. So actually, the answer to this is we focus on the strength in the technique over age because I know there are some schools that it 9 to 11 years old, that's when they start points. But actually, it's not all the time. You can start later. It's okay to delay it for as long as you first build the technique and the strength.
we see that number of years into one consideration.
Yes,
Say 5 to 7 years
yes,
of training can be a gain
Yes.
instead of age.
but also I think in terms also of the quality of the training, and
Agree.
it also goes hand in hand with the age group. Because for example,
Yeah.
you started ballet at 5 and you do 5, 7 years of training. Okay, that's quite long. But for example, there are those who start ballet in a very late age, such as in adulthood,
Right.
in 20s. And because they already have that maturity, that
Correct.
strength of being an adult, just if they have the proper training, just 2 to 3 years, they might already be able to develop the enough strength to go into points. So again, that's why it's still in quite a debate.
There's also that, the readiness of the bone, the
Yeah.
ligament. Yeah, hindi pwedeng madali.
And then another, in terms of progression, that we want to know, what we want dancers to know is that complex steps are actually just a combination of your basic movements. So, for example, would any of our dancers here know an Italian pate?
Ayan, yeah. Italian poetry.
Do you know an Italian pate? Yes. Can you show me, even just with your hands, what's the movement of an Italian pate? Okay. Yes, very good. So that is a very complex step. But if you look at it, is it okay? I bring you here a little. Okay, but if you look at it, it's actually just a combination of little movements. So for example, what's the start? You have to do a coupé, and then a relevé, and then a développé. And then you frappe and go into attitude. Yes. Very good. Thank you very much. So all those small steps are actually things you already focus on at the bar. So what we want here is that you master the basics first before you go into the complex movement. Do not sacrifice the technique. And then there's also a question of load. So this is the usual seasons in dance. This is actually more of sports. So in sports, this is more of a year-round thing. In dance, kasi usually you have a lot of seasons in a year. And when we say competitive season, that's usually the performance season. So the main takeaway here is that during the pre-season, this is when you're preparing for it a few months before the performance. This is when you're just starting to condition your body. Okay, you're just mastering the basics. It's not yet into the choreography. So here you just want to build it up. You want to have high volume, so madalas, pero low frequency, low intensity, so it's not as difficult. However, when you go into the competitive season, this is already when you have rehearsals after your technique class, extra pointers, and extra classes. So this is when dancers usually reach their peak fitness. So here there is high intensity, the classes are more difficult, but sometimes what we want here is to counteract that with a lower frequency or lower volume of load. So here, but however, here what I want you to look at is there is usually supposed to be a tapering period right before the competition. So we don't want that at the week of the competition, the training load is the maximum of the dancer. Or else, baka po ma-burn out siya during that week. Baka during that week pa siya ma-injure. So actually, there are studies that have shown that having a tapering week before the competition will increase their performance and decrease injury. And then this is where we will have some difficulty, the post-season recovery. So it is quite difficult to tell dancers to stop dancing and to just rest. Okay, it's just 1 week, 2 weeks of not dancing will already make it very hard for them to come back. So what we want here to do is to do active rest. So not necessarily stop and just go home and go on vacation, but more of just do other physical activities that are not as intense as you were doing during your competition. So you're still allowed to move. You're still allowed to do your the cross training. You can
Maybe
enter
cross
that
training.
there. Yes, so that your fitness is maintained, but you are not going to be as prone to injury. So pointers, again, gradually increase the load, which is the intensity and the volume, and to master the basics before advancing. So talking about the post-season, we have your fifth tip, which is the rest and recovery. So here, what we want is to prevent overuse. So, and to do this by using alternative muscle groups or focus on other muscle groups. Here, during your rest, for example, after class, you can use modalities such as warm compress. You can massage so that you can prevent some muscle soreness. And of course, you want adequate sleep, 8 hours, ideally. And then, of course, also adequate nutrition and hydration, which I think was the very first topic of your classes this week. And then next, we have the proper footwear. So here, you can see that depending on the type of dance, there are different types of footwear that you need. So ballet flats for the beginners. We actually are not sure what this is. I'm sorry. This one is actually for modern dance, for contemporary. Diba? They usually dance barefoot, but they can have this sometimes we call it toe pants. So it has an extra grip. It has a sole there at the bottom. And then we also have the point shoes, we have the jazz shoes. So it's not a one box fits all, but the things that we want you to check is one, is it the proper fit? Is it able to grip the floor? And is it able to support your feet? Because, for example, here, what can you notice? Both of these are actually not supported. Okay? So if you see the first picture, the shank is too straight, it's too hard, it cannot support the arch. However, this is actually what we call a dead shoe. So if you saw, when you go over your points, It's already over the box. Okay? It's okay. Go ahead. So what do we do with these? Sure, you can sit there. Oh, I remember. So for the first one, what you want is you want to break in your shoes. There are different ways to do this. Some they cut, some they actually break it.
Yeah.
And then actually there are some modern shoes that are actually already broken in when you buy them. And then of course you discard the dead shoes. I know shoes can be expensive, but it is more expensive if you have to get treated for a bad injury.
That's right.
And then next is you want to provide a safe environment. So this can be your studio and it can also be your theater. So the most important actually is your floor. If it is too hard, there is no shock absorption. So when you jump, all the stress goes to your bone. When it is too slippery, you can fall. And if it is too sticky, it has increased friction. And when you do your pirouettes, it will stop you from turning. And again, be a risk for injury. So common solutions for these are one, the sprung floors, which thankfully you have here in the studio.
Thank
And
you very
then-
much.
And then also a rosin box. Do you know what a rosin box is?
No.
No? Okay, it's like a yellow candy. It's very sticky when it becomes powder. Alternatively, because this is quite expensive, sometimes what we use is Coke. So you can actually spread it in the stage floor and then it will make it a little stickier and safer. However, the stage is not the only environment that dancers have because you have on stage and then actually you have the backstage. And sometimes it's the backstage where you can have injuries as well. Because look here, these are the wings. You have curtains here. That's where you exit and enter. Dancers can sit there. And then here, that can be all your props, all your costume, all your lights. Sometimes there's even what we call a backstage choreography, where you need to know where to go. So this is something that your director should have in mind when they produce a show. Okay, so just to summarize, here are our key points for injury prevention. We have what the dancers can do, and then what your teacher and then the studio also can do for you. So for dancers, focus on your nutrition. You have to do your warm up and cool down. You master your basics. You have rest if you can. And then also, you do cross training. And then also proper footwear. And then when it comes to the teacher and the studio, oh, sorry. We have the proper class structure. So again, the bar, center across the work, and then pull down. And then we have early correction of technique. So this is what's important for the teachers. When you see that a dancer, especially if they're still in a young age, and they're focusing more on the height of their butt mass versus the alignment of their body, you have to correct them already at an early age because we don't want them to develop bad habits. Okay? And then we safely progress them. Hindi kailangan magmadali. And then we have to provide them recovery periods because dancers will not, usually they won't tell teacher, I'm tired, I want to rest. Okay, it has to be the teachers to advocate for this, that their dancers have time to recover. And then of course, the safe environment inside and outside the studio. So again, we are from Pamana PH. We advocate for the wellness of our performing arts community, including especially the dancers. Thank you very much for listening. Thank you.
Thank you very much. Question? Maybe the dancers have questions? Andun yung mga girls no, sa likod. You have questions? In the Philippines, ano yung ating culture when it comes to progression to punch?
To point shoes. Well,
Kasi
I
sometimes, syempre, you have the parents, ano na, pension na yan. Ang gano'n, daming store na.
yes.
Now, what is that?
So, well, I think I can only talk from experience po. Parents they usually advocate for their children to go on points, or even that it's the dancers themselves that want to go on points because syempre, they see the older dancers, they're on stage, they're all on points, so they advocate for that. However, I think the teachers do assess first. However, yun nga po, sometimes it becomes, automatic na they only start to assess you when you're at age 9, 11, 12. So usually middle school. And then sometimes what happens is they go on points and then they build the strength while on points. Yes. So what we would like to advocate is that even before you go on point shoes, you already have the required technique.
Sabi ko siya rin. Kaso hindi mo alam kung okay ka.
Sorry,
hindi.
what's that?
Eh kasi syempre gusto mo kasigurado na malinis yung lettuce mo. Dahil hindi mo lulutuin yan ha. Kakainin mo diretso. Kaya ako din naisip ko nang bumili sa pali. Ay, parang hindi ko isa-sacrifice. Doon ako sa grocery na
yung nasa flat, yung board sa ilalim. Actually, pag nag-really have down injured dancer, they go first on the point shoe. They go back to the point shoe.
I will have to read up on that, Papa. I'm not so familiar with that brand.
Well, it's unusual in the US. It's actually more common in Europe. Than in So we'll be again posting this in our website. Just so you know, there's so many that are moving back and forth on the website, and they land on the page, on the videos, especially the ones that we posted recently last month. So I'm very sure this one will have many audience again. Thank you for this, Dr. Ria.
Thank you po for
Okay.
having us.
Thank you.